Hello, and a warm welcome to this Women in EP session provided to you by the EHRA Studio by ESC TV. My name is Emma Svenberg. I'm a cardiac electrophysiologist from the Karolinska Institute at Karolinska University Hospital in Stockholm, Sweden. And here today to discuss with us some burning issues within this field are two absolute experts. So I'm very pleased to introduce Janet K. Hahn, who is a professor of medicine at the University of California, Los Angeles, and VA Greater Los Angeles Healthcare System. And you're a practicing interventional cardiac electrophysiologist, and you're also the director of the Cardiac Arrhythmia Devices and Digital Health Program. And then we also have Elena Arbelo with us, who's an associate professor and cardiac EP at the hospital clinic in Barcelona. You're also the coordinator of the Cardiac Genetic Diseases and Sudden Arrhythmic Death Unit. So a warm welcome.
Thank you.
So to get us in the spirit and to get to know you a little bit better, I will start off with 3 quick questions. So first of all, favorite app, Janet?
LinkedIn for learning and scrolling and sort of getting to know people, and then TikTok for vegetating.
And you, Elena?
Well, honestly, I don't have a favorite app. I use many apps for specific purposes, but what I enjoy the most is actually nature, doing sports, and interacting with human beings, and social interaction. So I stay away from apps.
Okay, but speaking about favorite things, then what's your favorite EP procedure?
So EP, I like complex cases in SVT and VT, but especially challenging where you need to use the classical EP maneuvers.
Yeah.
But again, if I'm honest, what I like the most is the clinical interaction with patients. So that moment where you listen carefully, you sum up your experience, your knowledge, and then you help not only the arrhythmia, but the whole person. And I think that's beautiful of our job.
Ah, that's nice. And for you, Janet?
I gotta say, to go back to even olden days of me being a youngster fellow, my favorite has always got to be AV on RT, because there's a sort of thrill that you're like next to the AV node and you're like off, but also it cures people, right?
Yeah.
Like young people, it's done, cured.
Yeah.
So it's great.
Yeah. Okay, and the final quick question then. One food stuff you cannot live without?
You go?
Coffee. No question. I've had 3 cups already today.
So you're going to kill me again. You asked for food. I don't have a particular favorite food. I like the sun, water sports, and ideally, a little bit nice ways to enjoy water sports in Gran Canaria.
You've
My
never
favorite
heard
place
about
to be.
chocolate? Or what?
Chocolate and coffee.
I like so many.
The best.
different foods.
The best.
But so I wanted to talk to you about, so we talked about women in EP for years, but what has actually changed in the last 5 to 10 years, and what has not moved at all? Janet, what is your view on this?
I got to tell you, there's been a lot of good things, just even in my career. I feel like my career span now 20-something years, I don't even want to say. But in that span of time, what I've seen is we wrote a quick paper, probably around COVID times, maybe 2020, showing that there were more and more women in leadership positions, which I really didn't see when I was younger, right? So leadership meaning like cardiovascular society leadership. And even today, right? We heard Cecilia Lind is coming in as the next EHRA president. We have Sana Al-Khatib coming in as the HRS president in a couple weeks. We have ACC president Roxana Mehran, and the current president is Stacy Rosen of AHA. So I love seeing leadership because that sets you sort of the mentorship and coaching role for younger people to see women in action, right? In cardiology and in EP. Now, if you want to ask me the things that have not gone so great, I got to say, we've been struggling, as you well know, that there's not enough women in EP. Period, end of story. We are still the bottom of the entire group, right? EP is, we were 9%, I believe, and I think we're like 14% of enrolled fellows in the United States. That is worse than interventional cardiology. That's about 20-something%, worse than cardiology, which is 30%, worse than internal medicine, which is 50%. And we're worse than all the surgical subspecialties, including neurosurgery, which is like 30%, right? So we still have a lot of work to do. So I'm hoping that, in this table and outside in the audience, hopefully we'll come up with some solutions, right?
Yeah. And one of these, I think, is mentorship. That's often highlighted. But what do you think works in practice, Elena, when it comes to mentorship? Do women need female mentors in particular, or is it more important with a structured sponsorship than who your mentor is? What's your opinions?
So I honestly believe that mentorship matters, especially in your early career. It opens up your mind if you have a female role model, we're talking about women, that shows you that this is possible, this is something you can do as a woman. But the truth is that, in my opinion, sponsors are the ones that really open the door. So a sponsor puts your name forward, a sponsor trusts you with real opportunities, it advocates for you when major decisions are being made. So as a woman, we always get encouragement. You get some specific rules like quota that, you know, there needs to be a 30% women or 40% women speakers. I think that's not enough. You need a sponsor, somebody that really puts your name forward so that your trajectory is absolutely changed.
Yeah. Yeah, I think that's important. And during your training and career, have you encountered any particular biases or barriers that are specific to women in this field? And how did you overcome them? And I'll start with you, Janet.
Yeah, I think for me specifically, myself, I think there's an assumption that I'm, smaller stature, I'm Asian, I'm a woman, all three things. And then there's an assumption that, take a back seat, you're kind of quiet, and pensive. People don't think you're pensive, they think you're not daring, right? They don't think you're thoughtful, they think you just want to be on the side, right? So I think that part you have to work a little bit harder to make sure you stand out a little bit.
Yeah.
I think that's been difficult. On top of the mentorship, I think for me, mentorship was difficult because there were not women, in my program at that time, so.
So
for you, Ellen?
I completely agree with her. I think we have both barriers. We have some internal barriers. So you think that you need to demonstrate more, that you need to gain more experience to actually make it to a particular position or something. So this is some difficulties that we self-impose. It's nothing coming from the outside. But the truth is that there are also structural and cultural barriers. So women, so the competence in women sometimes take longer to be approved or shown, or your visibility comes later. Assertiveness, if you're an assertive woman, it may be interpreted differently depending on the context or who you are. So I think we have to work both sides. So what really helped me was actually focusing on the substance of EP. So gaining a lot of experience, training a lot. And one thing, I think an important thing we have to give is to force ourselves to say yes to opportunities. Even 100%. If we feel that, well, I'm not sure this is, I'm up to that level, but a lot of that is
internal.
Imposter syndrome. So you're not feeling you're up to the task, but you really are. So you have to force yourself to say yes. And eventually what really led me to feel comfortable in leading is that we do not have to lead all the same way. So you can be yourself, shine, become a leader woman in EP just by collaboration, being assertive, and helping each other, and feel comfortable with yourself. Yeah. So that's my key message to the women out there. Be yourself.
And you've both built, really strong professional networks. What are the concrete steps that actually open doors for you, Janet, leading to speaking, speaking conferences, leading studies, becoming faculty? How did you
That's
do
a
it?
lot of stuff.
Yeah.
So, I gotta agree with Elena, because I think women don't say yes enough, because I think we wait until we're 100%, 150% ready, overly ready, right? When we may be, 90%, and that's good, right? That's A, right? So I think saying yes to opportunities more than saying no, especially early in your career. I think the other thing is making sure that you volunteer yourself. Nobody's going to pick you out of a bucket, right? No one's going to see you if you don't speak your voice up, and making sure that, your name is out there. I tell my mentees, Nobody's going to come rescue the princess. You have to be Joan of Arc, right? You have to like lead the charge yourself and get yourself in front of eyes. Otherwise, no one's going to know who you are. And then I think the last thing I'll say is you have to really work hard. This is not something that is given to you, to anybody, right? You work hard and you honor your commitments and you follow through. Because if you don't do that, then all the stuff that you do to volunteer doesn't make a difference, right? So follow through for sure.
Yeah. Deliver on the things you do.
Deliver, 100%.
Yeah. So if you could change one thing tomorrow to accelerate female representation in EP, what would you do, Elena?
If I had to propose one thing is, and you know me already because we've discussed this, we need to stop assuming that we understand the problem.
Yeah.
We do not understand the problem. We often explain gender gaps with easy narratives. So family choices, we lack confidence, a fear of failure, but many of these things, or if not all, are assumptions.
Yeah.
And so before we prescribe any type of solution, I think we need a deeper analysis. And then with that deeper analysis, we have to redesign the rules of the game. Because these rules of the game in research, in leadership, in career development, have been designed by men. Because there were only men at the beginning of EP. So we're trying to force quota of women with the old rules. Maybe what we need to change are the rules of the game so we actually ensure diversity, not just for women, but for different contexts, so that this is broader, this is fairer, and more evidence-based. And I'm going to give you an example. So we've been complaining that women representativeness in research has been very low in any cardiovascular trial, 30% max of women. But there was a recent paper, I've been advocating for this forever, and somebody did last year, published, analyzing all the clinical trials in cardiovascular fields. And where you have a female first author, there you have more inclusion, and it's more 100%. Balanced. So we need to give some thought at the whole picture, try to analyze it better, and then propose solutions that are up to date, not just trying to fit us all in the same box.
Yeah, I agree 100%, as you know. So with that, I'd like to thank you so much for joining me for this discussion. And tomorrow, there will also be a session on empowering women in EP at 4:45 in room 3. So I hope you join us there. There will be coffee and cakes, I've heard, and also great discussions. So thank you so much for joining. Thank you.
Thank you. That was great.